I'm Tom Filardo. I'm a physician from Cincinnati, Ohio. I come speaking with a background of 4 years in the National Health Service in rural Illinois, where I was the only physician for 1 year and one of two physicians for several years. I've a varied career in academia and currently work in surgical research. I'm a landowner on Pelee, and I bring my family here 5 or 6 times every season to enjoy the amenities and the relaxation that Pelee affords. I've become aware of the problem with the potential closure of the clinic on Pelee Island, and I'm rather alarmed by the what I consider to be rather irresponsible lack of insight of the needs of a community like this, which is isolated and which is consumed with various occupations that are relatively dangerous. Farming is, as I think everyone is aware, quite a dangerous occupation, and many of the injuries that farmers sustain demand relatively immediate care that can't be scheduled on a partial coverage schedule, and which puts the burden on the medical profession, of which again I'm a part, to be available and responsive to the needs that come up. I'm a member of the Pelee Club, which has been on the island since 1883. We bring a number of people to the island every year. There are 24 of us, about half children right now visiting, children who are occupied in the normal things that children are occupied in, and susceptible to the kinds of injuries that need immediate care. I myself have been called on to administer emergency care on a number of occasions when we've been out on one or another excursions on the island. And also when my wife and I have come with our children who were then smaller, we've actually utilized the services of the clinic because in the rush of packing and school responsibilities, we neglected to bring some of our children's medicine with us, which the clinic was able to provide. I think the provision of a couple of nurse practitioners or nurses who are experienced in acute care and emergency stabilization is a minimum responsibility that should be met, and it seems to me that given the burgeoning bureaucracy, it's one for which funds ought to be able to be found. I think that what's happening here is, again, a plan for negligence and irresponsibility, and I think it should be turned around. Thanks for your time.